Hey, welcome everybody. It's time once again for another episode of Health Talks with Dr. Trinh. The one show, maybe the only show, where we show you how to live a healthier life from the people who are doing it, including some of those who are going through it right now. With the man who's always going through it, Dr. Trinh. Hey, Dr. Trinh, how are you?
Hey, very good. Good morning, Paul. Good morning, Dr. Raymond Chang.
What a rarity. You have somebody with you today who's not only a well-known doctor and an expert on COVID that we're all still scared about and dealing with. He's dealing with it.
Or has dealt with.
Has dealt with it. Yeah, right.
Yeah.
So bring your guest on and introduce him.
Yeah. So Raymond is my good friend. We have known each other over 20 years, actually. When I started Bristol Park Medical Group in 1999, and didn't you kind of start around that time, Raymond, with your organization? I don't remember.
Yeah. Around 1998. Yeah.
Okay. Yeah. A little bit before that, and so we have known each other for a long time and have collaborated and have had mutual patients back and forth, Paul.
Okay.
What we have done over the years.
So what did he create back then? What is the center that he's now associated with here? You said
the name of your organization, Ray.
Oh, it's called South County Kidney and Endocrine Center, SCKE.
And what do you do there? And what is endocrine?
So I am a nephrologist as well as endocrinologist, and so we established with specialists, and then we started to recruiting some of our primary care doctors. So now we have about 14 providers and multi-specialty clinic.
Okay.
So we specialize in basically general population as well as a patient with a kidney problem, diabetes, thyroid, or any blood pressure cholesterol issues.
And what is endocrine? I don't know what endocrine means.
So endocrine is a study of the hormone.
Oh.
So basically, everything has to do with the hormone, diabetes. It's all part of the endocrine system.
Okay. You got to dive deeper into that. I had no idea your hormones have anything to do with your kidneys. Your kidneys, I get it. That takes all the fluid and it filters it out and gets all the bad stuff out, and that's how you, I guess, pee all this stuff out here or something. That's what your kidney. That's all I know about the kidney. But the endocrine, you got me on that. And hormones, I had no idea hormones have anything to do with your kidneys.
Well, they're two separate specialties.
Okay.
Yeah, nephrology is the study of the kidney, and endocrinology is study of the endocrine system.
Okay. And the endocrine, talk through this. I don't know what where is the endocrine system? What does it do? How do I see it? How do I feel it? What is it? Give me a brief history of explanation of what it is.
Okay, so your thyroid, right? Your thyroid control your metabolism. So that's one of the endocrine system. Diabetes actually basically managing in your body through insulin. So insulin is a hormone from your pancreas. So that's also part of the endocrine system. And of course, testosterone, right? Men's losing testosterone as they get older. Yes, you're right.
Right.
And the female going through menopause. That's all part of the endocrine system.
My wife will give you, I'm going to ask you a little free advice here. My wife has had a miserable time going through menopause, been doing for years, and she can't seem to totally get it. She's tried hormone replacement. She's tried natural things and nothing. She just had to sort of gut it out. Is there any answers to when women go through these hormonal changes? Some people have a relatively easy time. Some people have miserable times. Her mother took years to go through it.
Yes. So your body features has something to do with that, of course, because estrogen tends to stay in your body fat. So overweight women tend not to have any symptom when they go through menopause. Skinny women, they tend to get more symptom because
she's a skinny woman. There you go. Right. Yeah, exactly. She's a small, skinny woman here. So she doesn't
they tend to have to suffer more.
Yeah. Okay. So tell us about your own, and how do you then deal with COVID? What does COVID have to do with any of these things?
Well, I I was a patient in the beginning of the pandemic. I basically came home one day, Monday, on March 23rd, and I felt that I had some chills. And so when I came home, right away I told my family, my wife and my kids that we should quarantine myself because at that time I thought that I should assume that I may have COVID.
Wow. Which many of us did not. To this day, people think, oh, I was just talking about somebody the other day. Woman who runs the American Heart Association here in Orange County was on one of our shows, and she admitted, she said, my family just went through whole horrible COVID experience, and it started with me coming home. I just thought it was the flu, and I kept working. I ignored it, even though this is 9 months into it. She still just, or seasonal allergies or something, whatever she said. Yeah, something. Most of us don't assume the worst, but you did.
Well, because we were told if you have any symptom at that time, you must assume that you have COVID.
Right.
And since we didn't know much about it, I just basically assumed that I had COVID. So I came home, I quarantined myself right away. And so of course, being a doctor, we're the worst patient, right?
Yeah. Right.
Basically, I self-medicate. I took the Tamiflu, the antiviral medication. I took multiple antibiotics. I even had some access to the oral hydroxychloroquine.
You tried that too, anything and everything.
You know, it was so uncomfortable. And I remember my wife and my kids have to deliver food in the doorway. So I went out with my mask and glove to pick up, and I could barely eat any of them.
Wow.
So, of course, I passed out a few times between Monday and Friday. And every day, my wife told me I should go to the hospital.
Mm-hmm.
But not you. You don't need to go to the hospital. I'm tough. I'm a doctor. I can do this
Doctor.
myself. Yeah.
Doctors don't need the hospital.
No.
Yes, yes. So basically, I finally brought my wife dropping off at the emergency room, Salabad Hospital.
Uh-huh.
And the physician in the emergency room and the staff are so nice to me, took me in right away. Remember, that was a Saturday, and they assumed that I had COVID. But unfortunately, back then, they did a test on me right away.
Right.
But it wasn't confirmed that I had positive for COVID until Tuesday.
Was it a delay in diagnosis? A delay in getting the results?
No, it was because we didn't have that much experience in testing the COVID. Everything was done very proper.
Yeah.
In a time manner. But the results of the test took a little bit longer because we were in the beginning of the COVID.
Right.
But they treated me as if I had COVID. And right. And so I went to the ICU right away. In less than an hour, I was in the ICU, intensive care unit.
What kind of symptoms did you have? Was it like flu-like symptom, like fever, chill, or was it loss of taste and smell? Anything specific?
I couldn't smell and taste the second day, and I had very bad chills.
Okay.
Fever, severe headache.
Wow.
Body ache. It's something that the worst feeling you ever have.
Yeah.
Of course, I was in the ICU since day one, and they also gave me IV hydroxychloroquine, couple antibiotic.
Yeah.
Very, very nice. Do the best they can to take care of me.
Right.
So you're at the very front end of this. March was when we were just panicking. We were just hearing about this, and here you were handling it.
Yes. Yes.
Wow.
In fact, I was actually one of the very first COVID patients for the nurse and also the doctors.
Oh my gosh.
Wow.
Yes.
That's a good feeling when the doctor comes in and says, I really don't know how to handle this, but let's try this.
Yes. They all done a very wonderful job, and I'm very thankful to them, all the nurses and the doctors.
So how were you as a patient? Did you believe it? Here I am a doctor. I'm not supposed to get sick. You guys go through anything.
Well, so they kept telling me that I need to be intubated.
Intubated.
And very difficult breathing.
Right.
But again, being a doctor with the worst patient, it was debate about whether early intubation is beneficial to COVID patient or not.
Right.
Just happened to Google Germany that time that they published a paper that we should delay intubation on COVID patient. So I basically told them that I'd like to I decline intubation, and I try to stay awake and breathe myself just to avoid that.
So why is it that doctors have to handle their own case? It's like a lawyer defending himself. Why can't you just trust the doctor like we're supposed to do and say, whatever you think, doc, I'll take your advice. I mean, yeah, you have some consent, but instead the doctor says this and you're like, wait a minute, I'll go back to you, and you're doing your own research and your own stuff. We can't listen to somebody else just tell us what to do.
Right. The doctors that were taking care of me were also colleagues and very good friends, and we have very good communication. But basically, if I pass out, I really need to be intubated, and I told him, go ahead and do it.
Right.
So
you did not get intubated. They didn't stick a tube down your mouth here.
But your oxygen level, was it like under 90%? Is that why they told you need to get intubated?
yeah, so they occasionally you'll drop down to the low 80s. And I remember a couple times, 2, 3 in the morning, they all came in and, hey, doc, we need to intubate you. And I'll tell them that, no, don't worry, I'm going to stay awake. I'll breathe, and they give me oxygen. And so I'll do what I can to avoid intubation.
Why did you not want to be intubated? Is that because of the severity of it or the risk of it, or what was the hesitation?
Because the paper that I read about that, you delay recovery, and also your prognosis is going to be a lot worse if you get intubated.
So is that still true?
Absolutely necessary.
Should people delay intubation? Because I always thought that's why you go to the hospital, and if it gets down into the 80s, it's supposed to be in the 90s, your oxygen level. Boy, there's no hesitation. Get you on intubation, or I mean, that's the general feeling. Get it on as quick as possible, but you're saying no.
Well, sometimes intubation, there's no choice, right? Because you get so tired that you no longer can breathe on your own. You just give up breathing, so you have to be intubated to survive. It's like intubation versus death. What choice do you want?
Yeah, right.
But the idea is to delay as long as we can the need for intubation, which is, it's like delay as long as you can the need for, surgery or, different things of that sort. And intubation is required if you need it, if your only other option is death.
Right.
But the idea is, to minimize the need for intubation. That's why we use BiPAP, right? That's why we use other modalities in the hospital to kind of replace the need for intubation.
All right, Dr. Trinh, let's go back in time. We're gonna rewind the clock here. You're the doctor handling your friend Raymond Chang here, and he's down in the low 80s. Are you arguing with him and saying we got to get you in there? Or you're like, no, whenever.
Well, first I'll probably check his prostate exam, make sure it's okay. Do a few other things. Look in his ears, but no, I'm just kidding, guys. I would probably, if he's down in the low 80s and he's on maximum, oxygen that I could give him, he's on, the maximum liters of oxygen, I would look toward intubation if he looks tired and it looks like he's about to give up on his breathing. Intubation is really not an option after that. But Dr. Chang is, as non-compliant as I am. I don't know how many physicals have you had done, Raymond, in the last 10 years? Because I don't get it every year as I should.
Yeah, right.
I'm still virgin in my prostate exam.
Okay, that's great.
Glad we needed to know that. That was on a need-to-know basis.
You get to learn something educational.
All right, so you went through this, but you made it. How did you make it through, and what was that process like afterwards?
So basically, I think the good things that I exercise every day. I practice what I preach in my patient. So because I pretty much have a very good system. I run about 3 to 5 miles every day. I think because of that,
Okay.
my lung capacity and is very healthy and able to get through that. I almost burned out my muscle to help me breathe, but after a few days, I was able to survive without intubation. However, I developed this thing called Cytokine Storm.
Oh,
Major reason that patient died from COVID-19.
right. Describe what that is. We've heard about it. Cytokine storm. What does that? Your body suddenly is overreacting, trying to kill what's there, and in fact kills you.
Yes. So COVID-19 kills human two ways. It makes your body inflamed, the cytokine storm, and then the other mechanism is to make your body your blood very thick. It's called hypercoagulable state.
Ugh.
So the body develop blood clots, and at the same time, you're severely inflamed. So I was in cytokine storm, and now we're dealing with not my breathing problem, but we're dealing with the other issue. So during that time, we did not have any monoclonal antibody to target on the COVID-19.
Right.
My doctor did a lot of research and chose this medication called tocilizumab that actually targeting at interleukin 6, which can decrease your body's inflammation. And he gave me 2 doses. And after that, I recover very fast.
This was a monoclonal antibody?
Yes, that was a monoclonal antibody against interleukin 6. And my marker for interleukin 6 was greater than 150s back then.
What is interleukin 6 or whatever this is? I have no. Now you're talking in the weeds here. What are we talking about here?
So it is a marker blood test to measure your body inflammatory state. And the level less than 2 is normal. Mine was over 150.
You are 150 and it's supposed to be less than 2?
Wow.
Yeah.
So your body's really inflamed and it's going crazy. What happens, Dr. Trinh, when this cytokine storm erupts? It's an overreaction in your body that ends up what? Shutting down your system? And so how does your body kill you trying to help you?
Inflammation. Inflammation in itself is part of the immune system's response to fight something bad, like a virus or a bacteria or a toxin. So imagine the bad guys is coming, and your immune system sees the bad guys and it rushes to battle, right?
Right.
You got the bad guys, you got the immune system, there's a big battle. Part of this battle, the result is inflammation, right? As the result. And so it's a natural part of fighting anything bad. And short term, it's fine because a fever is inflammation, right?
Right.
A fever is just a result of inflammation. And we need the fever to boost our immune response. But what if you had this fever every day of the month? Is that a good thing or a bad thing, right? So what happens is chronic long-term inflammation damages your own body, or inflammation that is excessive damages your own body. It's kind of like going into a battle and you have friendly fire.
Oh, yeah,
You're trying
right.
to aim for the bad guy and all of a sudden you're shooting the good guys.
Right.
That is the inflammation damage that occurs from coronavirus. And that inflammation results in blood clots, right? That inflammation results in ARDS, right? Acute respiratory distress syndrome, that leads to flooding of your lungs with inflammatory fluid that drowns your lungs. And as it drowns your lungs, your oxygen level drops, right? So so interleukin 6 is part of that whole inflammation cascade. And if you can block the inflammation cascade with medications, and we have these medications now, we call them monoclonal antibodies, right? There's 2 companies that are FDA approved with the Emergency Use Act, right? The one is Regeneron, the other one is Eli Lilly. They have really long names. One is called Bamlividude, or bamlanivimab, blah, 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 right? And then the other one has two long names as well. But these monoclonal antibodies is designed to block, if possible, right, the ability of the virus to bind to the host, right? It blocks the spike protein, the ability of the virus to bind to the host, to bind to your body cells. But we don't necessarily have anything yet that's FDA approved to actually stop the cytokine storm. But that's being worked on now. Is that right, Raymond?
Yes, yes.
So why do some people get a storm? Why does some people's system go crazy and others react appropriately?
Well,
Why do
so
some
basically,
overreact?
You have a virus attacking your body. Just make it very simple.
Right.
And your immune system is trying to fight the virus, right? So when the virus is getting too strong, your immune system becomes even stronger, to the point where your body doesn't recognize the virus versus normal cell. So your body started to attacking the virus as far as your bodies.
Attacking the good stuff and the bad, like he said, friendly fire. It's shooting the good part of your body and the bad invader.
Exactly. So your body don't know which is good guy, which is a bad guy. Basically trying to attack the virus and your cell, your normal cells.
Where does this mostly show up? In the lung? And like he's saying, your fluid builds up and now your oxygen level goes down because you can't breathe. In your heart, in your kidneys? I mean, where does it show up? Everywhere, anywhere? What is it that it starts attacking the most? And what is the most deadly attack?
Okay, so basically the COVID virus enter your body through your receptor called ACE2 receptor. Mm-hmm. Now, ACE2 receptor is very much concentrated in your lung, the small alveoli, everywhere. And to make it matter worse, the ACE2 receptor also concentrated in your kidney, your heart, your brain, everywhere in your body.
Wow.
And so, yes, it is everywhere. But the reason why overweight patients have higher risk for COVID-19 is because ACE2 receptor also have a lot more abundant in those overweight patients. For they are higher risk because they have more abundant of this receptor to invite the COVID-19 virus in their body.
So they get a worse case. It enters in more places. It invades more of your body.
Exactly.
It's not isolated to one place here. So then they say all the time, well, if you have underlying conditions, we'll put little air quotes around that, underlying conditions. You have diabetes, you have, I don't know, you got asthma, you got some other things. Why does that just make your body in general weaker to fight things, or does it specifically weaken something that you need?
It basically weakens your immune system, yes.
Yeah. Okay.
Yeah. Think of inflammation and the damage from inflammation as this. You have, and I'll go back to my wartime analogy, right? You got an army of viruses,
Right.
and you have an army of antibodies and your immune system, right? You got two armies fighting each other, except it's already invaded your body. So they're fighting in your city, they're fighting in your town, right? And they're in hand-to-hand combat, right? Using, their weapons in your own city. And then somebody throws up a big grenade, right? Somebody throws a grenade in the air and that grenade explodes. When that grenade explodes, the idea was to try to kill the bad guys. But if you indiscriminately throw a grenade in the air, it's going to hurt everyone around you.
Yeah, right.
That's inflammation, and that's the damage, right? That's why the body gets damaged. As your immune system's trying to throw grenades against the viruses, everything's being blown up around it.
You're blowing up the whole city. You're killing the enemy, but you're blowing yourself up as well here.
100%.
So when this happens, you're saying there are these monoclonal antibodies here that might help stop this. Regeneron's one we've heard about. I think that's what the president got early on when he went through it. Have we gotten better at stopping this storm, or we still need to come up with some new defenses and drugs to calm our guys down and to keep them from killing us as well. Our antibodies here. Have we come up with a better way to deal with this storm? What do you think?
Yes. Basically, there a lot of emergency room are trying to determine the type of patient that can be benefit with this type of monoclonal antibody. Given to them in the emergency room, monitor them for an hour, and send them home instead of getting admitted to the hospital. This is really life-saving with this 3 different kind of monoclonal antibody. There's one catch here. If the patient becomes too sick that require oxygen, then this monoclonal antibody may not work anymore. So therefore, the timing is very important. You need to literally be in there once you confirm you're having symptoms and you're high risk, overweight, diabetes, asthma, kidney problem, cancer patient. You need to be aware and have your doctor direct you to the hospital, emergency room to get proper treatment to avoid you from deteriorating into the hospital.
Because it seems like once it gets out of control, that if it doesn't get out of control, if your body is able to fight it properly and doesn't go crazy, you can win the battle. But it's when your body goes crazy and overreacts and gets out of control, this response team, you're in trouble. This storm starts. So the key is to stop the storm, right? Get there early enough so you stop the storm from happening.
Yes.
But we don't know what it is. We think it's just the flu. We just think it's something else. We delay. We put it off. We don't go to the hospital. In fact, I heard Dr. Chang say he didn't go to the hospital. None of us want to go to the hospital. We're gonna gut it out. We're gonna stay home. And then when it gets so bad, then we go to the hospital. Like, where were you a week ago, buddy? You got a storm going on here. We could have stopped this storm.
Yeah.
Yeah, so basically, you're saved because Yim's around.
Yeah, right. Your wife's around. There you go. She made you go.
Gotta give her credit.
All right. So
by the way, how long were you in the hospital, Raymond?
So I was there for 2 weeks.
Wow.
In the ICU for 2 weeks.
Wow.
Yeah.
That's a pretty scary experience, because those were the times where we were still debating, should we wear a mask, should we not wear a mask?
Right.
You know, is it real? Is it hoax? And you were already hospitalized during that time.
Yeah. I lost my appetite completely, and I came home. I lost about 25 pounds in that.
Wow.
Yeah.
What a weight loss program.
It's the best weight loss programs that have COVID-19.
All right, so now let's talk about long-term consequences. Are you a long hauler? Have you had any continuing symptoms with this, or did you fully recover?
I just recently gained my smell and taste back.
Just recently? 6 months later?
Yeah.
9 months later?
About a couple months ago, slowly coming back. And
Wow.
I have a little bit, my physical, I used to be able to do 3 to 5 miles every day, and now just slowly getting maybe less than a mile. I'm slowly improving.
Because that's what Dr. Trinh and I have talked a lot about. I'm going to have him talk about it in a second here. We don't know yet what the long-term implications were, particularly for those who entered the storm. If your body never kicks into a cytokine storm or whatever you call it, if it never happens, you'll probably get through it and you'll be okay. But if your body has this overreaction and a storm starts and you got to go into the hospital, we can save you. You're at risk, but we don't know what the long-term effects are yet, right, doctor?
That's right. Many folks, and this comes back to the debate. There's a group of folks out there who say, why are we concerned about this virus when the death rate is under, 1%, right? When the death rate is very low. Why are we shutting down the economy? Why are we shutting down other businesses? Isn't that like, communism, right?
Right.
When everything's being shut down. And although the statistics may be correct in the fact that, it could be 1% or less if you add in all the asymptomatic, right? If you add in all the asymptomatic cases that we're not catching, it may be a very low death rate. But what we don't know, and what we're starting to realize now, guys, and I'm realizing this because I'm on all these Facebook support groups for COVID survivors, right? In one group, there's 10,000 survivors in there. In another group, there's like 20-something thousand survivors in there. And the only post that I see in these Facebook group is this: I've had COVID 6 months ago. Why do I still feel sick? Why do I still have brain fog, right? Why can I not smell or taste? Why am I not being able to do all these other things still? Although COVID should have been gone, right? Several months ago. So we're starting to learn that COVID, when the virus is gone, the damage remains.
Say that again. Say that again. Just because we don't know. I never heard anybody talk about the damage. I made it. Whew, it's the flu. I got over it. I'll recover and back to normal.
When the virus is gone, the damage remains. Think of the battle between the two armies, right? Think of the battle between the two armies. They're shooting each other, they're fighting, they're arm-to-arm combat, and think of the collateral damage of the city, right? As you're shooting, you're blowing down cities and walls are falling down and the town's being blown up. Okay, so let's say the battle's done and the virus goes away, right? The virus army goes away, right? Your immune system army goes away. But what about the town around you that's been destroyed?
Yeah.
Right? That doesn't go away, right? That does not go away. This is why COVID is so serious that people don't think about. Because you may survive COVID, right? You didn't die from it, but did you recover from COVID? Right? Months later, people are like, why am I still sick? Why do I still have shortness of breath? Well, it's because your town has been destroyed by COVID. Right?
Can that town be rebuilt? We don't know yet. Or is this a lasting damage?
Raymond, what do you think? Can we rebuild this town? Are there vitamins and supplements and things we can do?
Does your body regenerate itself and just give it time, and your smell and taste will come back, and your heart will get back to, and your lungs will get back to where they were? Or is there a risk that this is a permanent damage?
We don't know yet. I think there are a lot of long-term sequelae as a result of COVID-19. I can speak about myself.
Right.
It was such an inflammatory state. My whole entire body, my joints, my muscle actually got reactivated to the point where I saw a neurosurgeon, and it was recommended to replace my disc because my back, my L5 disc was so inflamed as a result of this COVID-19 that I really had trouble walking and doing exercise. So I was treated with physical therapy, medication, and neurosurgeon actually recommended to do a disc replacement. But it was recommended to wait until a little bit later because we don't know whether if I have my surgery, it's going to cause more problems because my inflammatory state is still not coming down yet. So I'm postponing the procedure until later. So there's so many things we don't know about COVID-19. And I think that a lot of research are doing right now. One of them is the mental state. And I think Dr. Trinh is the expert in that area. So I'll let him speak a little
Talk
bit
about
that.
the mental state, because that's the other unforeseen consequence. What price, psychological price, do you pay for those weeks of isolation, those weeks in the hospital, that weakened state, that fear, that wonder? What is that, a psychological scar, or is that just a suck it up and it was a tough experience?
Yeah, I think what's going to happen, guys, is, as we are vaccinating patients and as we are spreading this vaccine out, over time, we believe that the rate of COVID will go down, right? The rate of COVID eventually will go down, assuming that the second strain and the third strains and all these mutations doesn't cause it back to go, to go back up. But what we're going to start seeing is that the rate of COVID, the new cases go down. We're going to see post-COVID syndrome go up.
Yeah, post-COVID syndrome. Sounds like post-traumatic stress disorder.
Exactly. And what is post-COVID syndrome? Post-COVID syndrome is the long haul symptoms that you have from COVID. We've seen so many people who still cannot breathe, who still have shortness of breath months after COVID is gone because of the damage that's been done to their lungs. So those type of folks will need some type of pulmonary rehab, right? Pulmonary rehab. We've seen folks like Raymond, who's got maybe some back issues, some musculoskeletal issues now. Those type of folks may need physical rehab, right? We've seen folks who have gone through depression and anxiety from this. Those type of folks may need mental health rehab by a therapist, right? And then we've seen an entire group of folks who have lost their ability to concentrate and have memory loss, right? We've seen Alzheimer's go, somebody who's stable in Alzheimer's, they get COVID, their mental decline goes like this.
Wow.
Rather than a slow decline like this, we're seeing like boom, all the way down, right? With patients with dementia and cognition. So those patients need some type of cognitive rehab care to boost their brain function. So the question is, how does COVID get to your brain? Right? How does COVID get to your brain? I mean,
isn't there a blood-brain barrier that's supposed to protect my brain?
Yeah, everyone thinks it's a lung problem. Like it's like the flu, you get all your lung problems.
Right.
Why would it even affect my brain?
Right.
And it gets to your brain in several different ways. The first way it gets to your brain is that the inflammation, the systemic inflammation of COVID, and we can measure that in the blood, right? Those are like ferritin, CRP, what else am I missing? Sed rate, aging, procalcitonin, right? These are all measurements of a blood test that can detect the measure of the level of inflammation in your system. The higher the inflammation, the weaker the blood-brain barrier.
Really? Say that. All right, so let's just go down a little rabbit hole for just a second. What is the blood-brain barrier, and why does a weakened system weaken the barrier? What is it, and why does it weaken it?
The blood-brain barrier is an actual barrier that is designed to protect your brain from everything else that's potentially dangerous in your body.
That's flowing through your blood, right?
Designed to protect your brain because your brain is your most valuable asset, right?
Right.
Our most valuable asset is our brain. Oh, that sounds pretty entrepreneurial there.
Yeah, exactly. Right.
But so your brain's the most valuable asset. We got to protect it. The high level of inflammation.
So is there no blood going through your brain, or it somehow doesn't? It goes through. I don't understand why. You think every part of your body needs blood?
It does. Every part of your body needs blood. Your brain needs the most, right? Each time your heart pumps, each pump of your heart, your body pumps in 20 to 25% of your total body's blood through your brain.
Wow. All 25% is going through the brain, but somehow there's a barrier that blood's going through, and it's somehow not able to transmit stuff in the blood into my brain. Is that it?
But it allows only the good stuff, the oxygen and stuff into your brain, but it tries to block out toxins. It tries to block out bacteria and infection. That's the barrier, right? But when you have extensive inflammation, there's compromise to that barrier, is what we see. The other way that coronavirus gets into your brain is through a nerve that's in here, right?
There's a nerve in your nose? Okay. I didn't know that.
Yeah. Raymond, can you explain that a little bit, the olfactory?
Yeah. Well, not only just coronavirus, even the influenza A and B, they can cause you to have temporary loss of senses, smell and taste through your olfactory system. And normally it takes about a year or two to recover from that. And olfactory system is part of your nerve. You can actually, from there, it can go to your brain. Sometimes you can have encephalitis, meaning the inflammation of the brain, and so forth.
Through your nose, it
Through
gets
your
to your brain. Great.
So if you think of how the virus gets into your body, right? Eyes, nose, mouth, right? Eye, nose, mouth. It's kind of like a monkey see, monkey do, whatever, right? So eye, nose, mouth. The virus comes in through your nose. As a matter of fact, I think the binding ability of the virus through your nose is much higher than the mouth. Isn't that right, Raymond?
Yeah, it's 5 times more.
5 times more. The virus
Wow.
gets through your nose
The
5
affinity.
times the affinity through your nose, which is why wearing a mask is so important.
Cover your nose.
Alex wants to know, is this throughout the nasal passages, or is this at the front, or is this, because your nose goes all behind your eyes and everything here, is that true everywhere? Can I get it through my eye into my nose? My mouth is connected to my nose through the back of my thing here. Is it just in the front here, or is it throughout this nasal system here?
Your nose opens up to an entire nasal cavity, right? This part of my nose is just the opening,
Right,
but it actually opens up to a cavity, right? We call it the nasal cavity.
right.
And in this nasal cavity is where the olfactory nerve comes down. So if this is the top of the nasal cavity and your brain is up here, right?
Right.
So this is my nasal cavity and my brain is here. Well, in my case, it may be a little bit smaller. Right?
Yeah, right. Well, no, or bigger. It might
Maybe
be
that's
much
part of the
bigger.
brain,
Might be
right?
much bigger. Right.
But if my brain's here, the olfactory nerve is part of the brain. So the olfactory nerve goes down from the brain and it goes in like this. So it hangs out like this inside my nasal cavity, right?
Yikes.
So the olfactory nerve is a passageway between the brain and the nasal cavity. And so when the virus gets into your nose and into your nasal cavity, guess what? It has a route straight to the brain.
Straight to the brain. Nobody has ever told me that before. So you'd think a lot of it would go into the brain. We don't seem to see it. We're still thinking it goes down into your lungs, but you're saying it can go up into your brain through this olfactory nerve that
Right.
sits between the two, the
So as
cavity in
it's
your brain.
traveling up to your brain through the olfactory nerve, guess what it's doing to the nerve?
Killing it.
Yeah, it's killing it, which is why you can't smell.
Wow. So
Does that make sense?
does that nerve grow back, or is it permanently dead? I don't really understand why some nerves can grow back and others are dead and gone. Your heart, they say once your heart is just damaged, it doesn't rebuild itself, right? Or maybe it does. I don't know.
I don't know. Some people have the nerves.
Some people have that. He always has to do these jokes here.
It depends on the severity of damage.
Yeah. So some damage can be recovered, but if it's too severe, it's permanent.
Raymond, are there any
Sure.
vitamins and supplements?
He wanted to make some. So is that true? If it's damage is severe, it's permanent to your olfactory, to your heart, to your lung. It cannot be repaired or recovered.
You know, it's only been around for a year, so we don't know.
Dr. Cheng, what do you say? I think we're free. I think he froze on us here.
Mhm.
We shorted his connection here.
I lost the connection there.
There we go. So let's ask you that question again here. If the damage is severe, is it permanent to your olfactory, to your brain, to your lungs, to your heart? Oh, I think he's still struggling with his connection there.
Yeah.
So we don't know. This is new. What can be repaired and what can't be repaired? In general, can severe damage be repaired, or is severe damage severe and sticks with you? When can your body recover and your olfactory nerve can grow back, and when is it too damaged and it ain't coming back? It's gone. Is there a point of no return?
The recovery from the olfactory system is a slow process, and usually it takes about 1 to 2 years that you can recover
So
your sense of smell and taste.
It can come back, but it takes a year or two. How do you eat if you can't smell or taste? Do you just take the food and swallow it? You certainly would have no appetite.
Yes, very difficult.
Because we react to food and a smell. The first thing a little kid does is smell the food. Do I like this? And if you can't smell it or taste it, I would think I can't imagine what eating would be like if you can't smell or taste.
Yeah, when I first discovered my smell came back, I was picking up my dog's poop, and I can smell so stinky. I was actually literally had tears in my eyes. Like, oh my God.
Love it.
Poop.
Poop, I can smell again. Yeah.
Yes. Yeah.
Wow.
Yes, that's because I was a designated person to pick out a dog poo in my house because I can't smell. And so I didn't do it. But when I finally could smell it a couple of months ago, I was like, wow, I was so happy. I was really happy.
Was that the most happiest time that you ever had smelling poop?
Yes. Oh.
Yes.
He called his wife in. She says, honey, I can smell poop.
Smell poop.
All right. So I don't know if you want to go there, Dr. Cheng, but I'm going to ask you anywhere. You seem like a tough, strong guy. You're a typical doctor. I can gut anything out. I can reason through anything. I am in control of myself here. Tell me what was it like? Did you become like a little kid? Were you scared? Were you concerned? Were you depressed? Were you angry? Were you upset? How could this happen to me? Or whatever. I don't walk me through that if you're willing to share any of that personal journey. You as a human being who's not supposed to go through this.
Well, so near-death experience, and your family cannot come visit you because of COVID. That's very difficult. A lot of times when people are dying, patients are dying, the family can be there and holding their hand, talking to them, comforting them. But no one can visit me. Even some doctors, they'll do the FaceTime with me because they don't want to catch the COVID-19.
Right.
So that part was very difficult. And I couldn't talk because every time when I talk, I couldn't breathe. So I basically was texting my family. And when one of the doctors told me that I may not make it, it was really hard for me to say goodbye to my kids, my wife, that like I may not be able to see them again. Yes, it was actually very difficult moment. And it's not the same thing as people dying from cancer. The family's there, but I don't have that physical contact with anybody.
Yeah, and don't we need that? I've been there when my parents passed away and held their hand, and you think it's a horrible thing to go through, but in a way, it's very comforting and amazing to be there at that moment. It's important to be there at that moment, and they say it's important for the patient. Nobody wants to die alone.
Mm-hmm.
It's a lonely journey with COVID, isn't it?
Yes,
Mm-hmm.
yes. And I don't think we've fully come to grips with that. This is the only health crisis, national crisis I can think of where we have to do it alone. When 9/11 hit, we huddled together. When there's a school shooting, we huddle together. We go to the church, we go to the bar, we get together with our family. Here you're told, go handle it alone. You're on your own. Stay away. That's not the way we as humans deal with crises or life-threatening situations. We want to be, that's when we need people. That's when we don't want to be alone. Well, thank you for opening up. I can tell it's difficult to talk about. I don't want to press it anymore here, but I don't think enough COVID people talk about this. It's something you just sort of say, it was tough and I gutted it out. What would you say to anybody going through it now? You were at the front end. What advice, they're listening, people who have COVID right now or who are going to get COVID, what would you tell them?
We told them, be strong. You hang in there. Your virus is going to die in your body. Once they die out, you're going to be able to recover. So hang in there as long as you can.
Any advice of how to be tough and how to be strong? Is it just the belief that you'll make it through? Is there some mental exercise you did to keep your mind off it, to focus on the future and not the fear?
I basically focused on I wanted to see my kids, my family again, and I'm too young to die.
Yeah.
I just the drive, the motivation that I wanted to walk out of the hospital, and it's just gotta be tough.
Isn't that the key, doctor? It seems like when you give up, when you lose hope, when you no longer believe you're going to make it, you seem to die. There is something about the human body that if you mentally fight to hold on, you got a better chance than if you just give up and say, I'm gone.
Yes. Yes.
In fact, I did sort of give up. It was so painful that I did mention to my treating physician, please just give me more pain medication, just let me go.
Wow.
Because it was so difficult to sustain. I was, with my body, I had 8 heating blanket, and I was still having chills.
Oh.
And the nurse said my temperature was 103, but I feel so cold, and I can't ask for more heating blanket. And my headache was so bad, to the point where I actually was begging my treating doctor that just let me go. I couldn't handle the pain anymore.
What an admission. You, who run 5 miles a day, who went through medical school. Anybody who goes through medical school has got determination that I can't understand. The level of focus and to be able to persevere and push on. It ain't easy to go through med school. It ain't easy to deal with patients, and it certainly isn't easy to go run 5 miles a day. You sound like you come across as somebody very determined, very strong-willed, very much, not in a, you're going to make it, you're going to get there, you're going to succeed. You have all that in your DNA. And even you got to a point where you said, I can't make it. Just let me go. This is more than I can handle.
Mm-hmm.
Wow.
Yes.
Well, so much more for the rest of us here, but you did make it. And most people are making it. That's the good news here. And you can make it if you get, I talk about that. That's just the three stages here. Number one, you can prevent yourself from getting it. And number two, if you do get it, there are now treatments to get you through it. And then number three, even if it gets bad and whatever, the chances are better than ever that you're going to make it, right? So talk about those 3 stages: prevention, quick care, and then the survival of this. I'm not saying it's easy, but all of that's improved, right?
Yeah, so basically, I think wearing masks properly is very important. And once you get positive COVID-19, if you get guided properly and get your treatment on a timely manner, it can prevent you from deteriorating to the next stage.
Yeah, don't ignore it. Don't delay it. Right, serious.
Yes. Yeah. Time is actually the most important thing when it comes to the treatment for COVID-19.
And if it does get bad and you're in the hospital, your chances are better than ever that you're going to get through this. It's not, but it's going to be hell. It's going to be hard. So accept that and believe that you're going to make it through it.
Yes.
Wow. Well, I believe this is a powerful story today. I applaud you for being open and honest and to be able to talk about this. Doctors, I never hear doctors talk about this, and you guys seem to be at the greatest risk of all because you're at the front lines all the time. How many doctors have gotten sick? How many doctors have quietly ended their life because it just overwhelmed them? Or depression or anxiety. I don't think or healthcare workers getting burned out. You are in a battle. You are at the front lines. And it's very, very, I don't hear anybody talking about this because you guys are supposed to be the strong ones, right?
Yeah. Raymond, how do folks learn more about South County Kidney Endocrine? Is there a website?
Yes, please.
Or a link that people can come learn about your organization?
Yeah, you can go to ack.org. And as a result of me personally getting COVID, I put together a PowerPoint slide for all the questions that you need that you have about COVID-19, including supplement, including question about vaccination, It's all in my website, and
Wow.
it's available to everybody. You can go and read about it, and I'll answer all the questions that you have about
Fabulous.
COVID-19.
Fabulous.
And Dr. Yang Trinh helped me update that information from now on, because we're learning new things every day. And so please feel free to go into our website and get those information.
Well,
So it's SCKE.org, SouthCountyKidneyEndocrine.org. And so the PowerPoint should be on there, and people can learn about COVID.
Yes.
That's
well,
amazing.
I suspect you're going to get a lot of people there because they were pretty quiet. The reactions this morning were all, oh my God, what are we talking about? What have I walked into? And very quiet and very, like all of us, like Dr. Trinh and everybody. Your story is very powerful. I thank you for sharing it. It's a story we need to hear. And you've got a place now. We all want to know what's going to happen. I don't know. People have had this. How am I going to survive this? What about this? What about this? You've got a resource now. Give it out one more time here. What's the name of the site?
SCKE.org.
SCKE.org. All right.
Yes.
All right. We're going to try and get some. What do you think, Dr. Trinh? Should we get some more people coming telling stories about going through their COVID crisis here? COVID Chronicles. We'll have some COVID conversations here. I look forward to more of these. I think
All
it's
right, Raymond, we have another project to work on. COVID Chronicles.
COVID Chronicles. There you go. Yeah, I think because I don't think people are isolated and alone. We don't hear the stories because we're not seeing the stories. We're kept apart from the story. I think just like we were talking about, you got to hear the real story from the horse's mouth, as they say, from the homeless we talked about before. And let's have the COVID people like Dr. Chang come forward and tell us their stories here. All right. Thanks, guys. There is hope. You made it, and you can too.
Thank you for having me here.
All right. Thanks for sharing it today here.
Coming.
You've been listening to another great example of the kind of stories and information we share each and every week here on Health Talks with Dr. Trinh, right here in Orange County's only community radio station, OCTalkRadio.net.